Good evening. Assalamu alaikum. Vanakkam to all of you. I'm Dr. Wasima Atif and I'm working as a lecturer in ICA. And I warmly welcome you all for today's webinar. I really want to say that this is a great pleasure to inform you that this meeting is our 6th conference about foreign job opportunities for medical professionals. In that way, we specially organized today's webinar to help the other health professionals and school leavers, especially science stream students, to achieve their future into the next level. So hope it will be a good beginning for all of us. Before entering into today's session, I would like to give a small introduction about an institute called ICA. So I think you all are now familiar with ICA, that is the Asian Institute of Kerala Ayurveda. This is the first institute that offering guidance and training program for medical professionals, health professionals, school leavers, and we are providing career guidance and programs about job opportunities in local and abroad. So ICA was established in the year of 2013. We are one of the few leading Ayurveda training providers in Sri Lanka. Especially, we are providing the courses in Tamil medium. And also, we are aiming to give the premier education and market relevant programs in Sri Lanka. So this is our vision. The thing is, we are giving the premier education to all of the citizens in Sri Lanka. So we are giving several Ayurvedic and medical related courses. So there are several professional diploma courses like diploma in cosmetic product manufacturing, diploma in acupuncture, physiotherapy, professional counseling, Ayurveda beauty therapy, aromatherapy and aromatherapeuticals, Kerala Panchakarma. Excuse me. All the participants, please mute your mic. It will be great help to continue our program in a good way. Thank you. And also we are offering so many herbal industrial export business courses. So we are collaborating with Osetma Traditional Medical Institute for Tamil Medium so that we can give Ayurveda department approved institution certificate for those who are completed our diploma programs. And also we are collaborating with Sitaram University in India and also Anne Aravind University in India. So these are the pictures of our convocation, which was held in 2021. These are diploma level students' pictures. So these are the success stories of students who completed diploma in cosmetic product manufacturing. You can see the success stories of students. So program. Before. As you all know that today's program is about medical coding. If you want to become a certified professional coder, you can get so many knowledge in in this webinar. So to host this webinar, I would like to welcome Mr. Riaz, BSc in Biochemistry and CPC certified medical coder from Coimbatore, Tamil Nadu, and have extensive experience in the field of healthcare over 15 years. And also the American Academy of Professional Coders approved, and he's from American Academy of Professional Coders Approved Institute. So once again, I warmly welcome guest speaker, Mr. M. Rice. Over to you, sir.
Hello, everyone, and welcome to all the Tamil people there. And Assalamu alaikum. And I'm Mohammed Riaz. Right, I'm from Coimbatore, Tamil Nadu, and today I'm going to present you this seminar on medical coding. And can you all hear me well?
Yes.
Okay, fine. Yes, thank you. Right, and thank you for the introduction, Dr. Wasima. Right. And so to begin with, so we are going to see some slides. Right. So I will also like to share the slide now. And I hope I can share the slide now. And have you given this host access, Wasima? Okay, I think I've been given the host access. And can you all see the screen now?
Yes.
Oh. Okay, so first of all, we will begin with what is medical coding. So can anyone tell me what is medical coding if you know about medical coding? Yes? You have any idea what is medical coding? Okay, so I would also like you to mute yourself because, right, if I'm talking, so some background noise is coming. So if you're able to mute yourself, so I will also explain you what is medical coding. Thank you, all of you. Okay, so medical coding is a process actually, right? And it's a practice in the US healthcare system, right? That after any medical services, so be it any medical services, be it a surgery, be it an X-ray, be it a diagnostic service. So after that, the US healthcare like, has the mandate that all these processes should be built as codes. Okay, so what is this code? So these codes can be interpreted as a dollar value. For example, if you have any surgery, right, and we are going to assign any surgery code, and this will have a dollar value. For example, if it is a appendectomy, okay, so in a state New York, you have this appendectomy performed, you will have a dollar value like $100. Okay, but this will not be directly passed down to the insurance company as the values, right, as a dollar value. So it will be passed down as codes. Okay, so that way, right, the medical insurance companies also understand and interpret the code as a dollar, right, and pay for the insurance company. You got what it is? Okay, so this is a process in which all the healthcare related services are converted into universally accepted alphanumeric codes, and this is for medical billing purposes. And it's a mandate, okay, that the government of United States has in its laws, federal laws, right, that we should use the medical codes approved by the AMA, American Medical Association, right, in all the healthcare related process, or simply, okay, the conversion of medical records or any healthcare records into codes. So this is the process, medical coding. Got it? Okay, what happens in US healthcare industry? Okay, and why medical coding is a mandated process. Okay, in the healthcare industry, US, so it does not operate like in India or in Sri Lanka. So where you have a patient, like in India, what happens is, so we go to see a doctor and we pay out of the pocket for whatever services he has offered, right? And then we will come back. And if we have any surgeries, we will have some like claims, and we will do that like claiming process. But in the US, right, so there is a scenario where you have 87% of the population insured. Okay, they will have either way or one government insurance or one commercial insurance. That's the case in US. Okay, so even before COVID, this was the statistics, like 2017 statistics, like 87% of the people were insured. After COVID, there was a rise in the population, like which who are insured. So like 5%. So now you have like 92% or 93% of the people are insured in the US scenario. I mean, that's a healthcare scenario in the US. So what happens is, so when the patient visits the doctor, and the patient need not to pay out of the pocket. So the insurance company will pay for the patient. So the patient will have some kind of coverage, right? And the patient will be paying some kind of premium for extra coverage. So that's the scenario in the US. Okay, how this doctor is going to get the fees? Okay, when the patient visits the doctor right has a medical record for the entire encounter. So that is converted into a medical record. So whatever the services that the physician has offered will be converted into a medical record. Okay, this medical record is translated into codes, right? By various steps we have, right? Various processes we have, right? We call that as the diagnostic coding and procedural coding. Okay, and after all these coding, this will be submitted to the insurance company. What the insurance companies do is they will run the code. Okay, they will run the code, and each code will have a dollar value, right? And that will be paid for the physician or the doctor. Okay, so this process is called revenue cycle management. Okay, our revenue of the physician is determined by this revenue cycle process, of which medical coding is the most important one, because the revenue of the physician is based on whatever we as a medical coder are going to assign as a code. Okay, each code will have a dollar value, so that's the exact revenue for the physician that's going to be determined by the codes that we as a medical coder assign. Okay, so that's the of the revenue cycle process. Medical coding is the most important process. You have various other processes like scheduling, right, pre-authorization. Then you have medical transcription. That's also a process, right? Then after this document is created, we code that, and then there is another process called billing, right? AR, accounts follow-up, accounts receivables. So that's other processes that are involved in the revenue cycle. But right, as far as medical coding or revenue cycle management is concerned, medical coding is the most important step, because the revenue of the provider or the doctor is going to be based on the codes that we as a medical coder assign. Okay, so that's the process. Okay, so in the healthcare scenario, there are three people, so three key players. We call them as three P's. Okay, namely the patient, provider, and the payer. Okay, the patient is the one much needed for any healthcare related services. Without the patient, we will not have any healthcare related services. Then provider. So we call them a provider because not only a doctor, even a surgeon can give a service, right? Even a nurse practitioner can give a service. Osteopaths, MDs. Right? There are various levels of providers who can provide healthcare related service. So that's why they call them as providers in general. Okay, then you have payer. Payer is your insurance, right? So insurance companies are called as payers. So they are going to pay for the patient's healthcare services. Okay, so that's the three-step process. So that happens in the US, healthcare industry, of which the medical coding is the most important one. Okay, so we as a medical coder are going to assign a code which will contain the important information for the payers, right? And that will be interpreted as fees for any healthcare related services offered in the clinic, right? Clinic or hospital. Okay, and this will be submitted to the insurance company, and the insurance company will pay for the service that the physician has offered. Okay, so next is what you need to be a medical coder. Okay, what are the skills that you need to be a medical coder? First thing is medical terminology. Okay, so because we are going to interpret the medical record. Okay, the medical record is not going to have some common English words, but right, the medical terms. Okay, so in order to understand the medical terms, so we'll be also right, we also need to prepare right ourselves with medical terminology, anatomy and physiology, so we know right what is the procedure being performed and right where it is performed. So if you know, so for example, I'm giving you one such procedure which is called as ERCP. This is an abbreviation for a procedure which is called as endoscopic retrograde cholangiopancreatography. Okay, so that's the procedural terminology that you have right for this procedure ERCP. So that will be right only you will find this in the medical terminology. So you will find this only right as ERCP. Okay, if you don't know what it is, you will not be able to code for this procedure. So that is why we have to understand the medical terminology and anatomy and physiology will along with it. So we will know that this procedure is performed right for the pancreas and the cholangia, bile ducts. Okay, so that's the entire meaning for this procedure. Right, it's an endoscopic procedure performed retrograde against the normal flow of right the bile duct and the pancreas. So cholangiopancreatography is the medical terminology. So if you understand this, we can code for this like medical terminology. So next is the manuals. So we call that as the Bibles for right medical coding. So you have the three manuals actually, right, of which one is for diagnostic reporting, the other two is for procedural reporting. Okay, so this is called as a diagnostic coding system, which is called ICD-10 CM, right, or International Classification of Diseases, 10th edition, right, and clinical modification. So this is clinically modified for the US healthcare industry because, right, so this ICD-10 is actually from World Health Organization. So that was clinically modified for US healthcare usage, right, by the right US organization called Centers for Medicare and Medicaid Services. That's the primary organization. So that deals with all the healthcare related services. Okay, then that's the right, diagnostic coding system. Then you have procedural coding system. We have two procedural coding system. One is CPT, current procedural terminology, and HCPCS, healthcare right, common procedural coding system. So these two are for right, procedural coding. So whatever surgery, right? So you have. So I've told you about this right ERCP, right? So you have a ERCP is a procedural term. So you have a CPT code for ERCP, right? And so there might be some right diagnostic problem. You might have a biliary stone, right? For which you'll have a diagnostic code from ICD-10 CM. Okay, so what's the problem and what is the procedure? And there should be a medical necessity, so which forms the bridge between the diagnosis and the procedure. Okay, so without that diagnostic reporting, we cannot bill for any services. Okay, so diagnostic reporting is not separately right paid by the insurance company, but we have to right prove that this is a medically necessary procedure for right this right condition. So you have a biliary duct stone, right? You can perform ERCP to visualize where the stone is, and you can remove it with at the same setting. So that is what the procedure is, and that's a diagnostic. And you have the bridge, right, which is called medical necessary. Okay, so medical necessity forms the bridge between the diagnostic and procedural coding system. So you have to report both together. Okay, so this is called diagnostic linking to the procedure. So if it is not medically necessary or medically not appropriate, it will not be paid by the insurance company. Okay, you cannot do this, right? Right? That's not ethical in terms of medical profession. Okay, you have to have some medical necessity for to prove that this procedure is required for this problem. Okay, then as usual, right, for all the computer related jobs, you also need to have communication skills, and you need to be right paying more attention because you are dealing with healthcare, right, medical records, so which will have all sort of informations. And for medical coding, it is said that every word in your medical record is critical for the codes that we are going to assign. Every word, right? So we have COVID. So nowadays you have COVID, symptomatic COVID and asymptomatic COVID. Okay, so you have a different type of COVID. Right? One is symptomatic and asymptomatic. Asymptomatic means there is no symptom, right? And symptomatic means yes, the patient has certain symptoms that establishes the diagnosis of COVID. Okay, but if you see the medical documentation between symptomatic and asymptomatic, you'll have the small letter A, right, which is going to tell you, right, there is another, right, diagnostic code for COVID-19, which is asymptomatic. So symptomatic, asymptomatic. Similarly, HIV. So you know HIV is a severe disease. So one patient with HIV will have a symptomatic HIV, right? So the patient is going to be paid, or right, the patient is going to be treated in a different way because he has symptoms of HIV. The other one, right, who is HIV asymptomatic, right, which means he's going to be having, right, a different scenario because he's not yet symptomatic. He's not considered as, right, having the disease. Okay, that is why he is not considered as symptomatic. So you have different codes, right, for symptomatic HIV and asymptomatic HIV. So for example, I will tell you, so symptomatic HIV is B20. So that's the code, ICD-10-CM code that we are going to assign for symptomatic HIV patient. And the asymptomatic HIV patient, we are going to assign Z21. See the difference between the two codes. One is in the B category, then the other one is in the Z category. Okay, so if you are going to miss a certain word, a certain letter in your, like, medical record, you will be ending up, right, the high chances you are going to end up in a wrong code. Okay, so attention to detail is also necessary. Continuous learning. So as you all know, right, these ICD-10-CM and CPT HCPCS manuals are, right, updated every year, because you have every year you have a new procedure, you have a new diagnosis. Like in 2020, we had this COVID crisis, and we had this new, right, diagnostic coding for, right, COVID. So every year you have some, right, updates here. So that is, right, also right, a requirement essential for, like, medical coding, which we have to be updated, right, about the codes and the, like, diagnostic and procedural terminologies. So continuous learning is also very important. Okay, so next, so I was telling about this manuals, right? ICD-10-CM, CPT, HCPCS. So in order for you to understand and how to code with these manuals, so you need to be, right, having a, right, certification to become a coder. So that certification is called CPC, or, right, Certified Professional Coder. And this certification of late is the gold standard for anyone to be a medical coder, even in India, even in, right, UAE, even in Australia, even in, right, US. This is the accepted, most accepted certification for medical coders. Okay, so this certification is provided by a body in the US. So that is called as AAPC, American Association for Professional Coders. So they are going to, right, provide you with the certification, and this certification needs you some training, right, on how to use this manual. So that training is called CPC exam training, so which we are going to provide, right, in the future. So that's an introduction to AAPC. So AAPC is the world's largest training and credential organization for the, right, business of healthcare. Not only medical coding, you have various other, right, certifications offered by the, like, AAPC. And AAPC has, like 2 million people as their members. So more than 2 million people are, like, AAPC members. So like 2,20,000 people are globally members of, like, AAPC, which means they have one or other certification in the, right, American Association for Professional Coders. And as I've said, so American Association for Professional Coders certification is recognized across all the medical coding and billing industry. So like you have in the US also it is acceptable, UAE also it is acceptable, and Australia also it is acceptable. And India, right, so where you have mostly the outsourced job, it is acceptable. And right, many countries are also planning to be, right, using the same technology that the US uses. So that countries also will adapt this medical coding process, and they will also accept, right, CPC certification as, okay, an accepted credential. Okay, so if you see this medical coding training, right, only few institutes in India are approved to be right education partner with AAPC. So only there are like six different I mean institutes in the India which are approved educational partner with the AAPC. Okay, so one such academy is our SASH Academy, so which is located in Coimbatore, Tamil Nadu, right, which provides quality education for CPC exam training. And as far as the CPC exam training is concerned, we give extensive uh, CPC exam training with the current AAPC's CPC exam curriculum. So every year you have a new curriculum, right? Because every year the codes are updated, and we provide like the AAPC's 2022 curriculum, right, for CPC exam training. Okay, so about the medical coding industry, post COVID, so many other industries have fallen, right? Like, right, IT industries have fallen, but not the healthcare industry. Okay, so after COVID, the healthcare industry has boomed in such a way that there is a surge in healthcare related services, and there is a surge in healthcare related jobs also. You can see, right? So nurses, doctors, so more doctors are needed, more nurses are needed, and so more patients are coming to the hospital, and even with the slightest doubt that they might have an infection or a COVID exposure, so they are coming to the physician's office for some kind of checkup. So there is a surge in healthcare related services. Even in the US, you can still see that there is a rise in COVID, right, cases, and there is actually a double rise in the number of patients visiting per clinic. So post COVID, you have like a 50% increase in the healthcare related service in the US. Okay, so that's the healthcare scenario in US. And right, most of the healthcare related businesses are outsourced to India, right? So you have 80% of the US healthcare business outsourced to India. And so of which, so you have medical coding, right? Like it is going to be like 60 to 75 percentage of the job related to medical coding is outsourced, and different countries also accept, right, or also follow the process of medical coding, like UAE and right, Australia, and even some other I mean Middle East countries are right, or in the right, talks about having this healthcare technology and the process, right, adapting this process into their healthcare industry. Okay, and there is a demand supply gap, okay, of medical coders. So even in the US, there is a demand supply gap, right? Even in UAE, even in India, right, where the most of the jobs are outsourced. So here is the right, the industry requires right 100 coders, but we have only 60 coders. So that's the ratio, right, at which the current scenario is. So where you have a gap of 40 percentage, right, 100 people required, but only for 60 people are working in the industry. So 40% there is the demand gap. Okay, so that's the scenario, right? And right, so the as the industry grows, healthcare industry grows, and the services are right more, the employment opportunities for medical coders is also going to grow. So there is an expected right projection of 25 to right 30 percentage increase in medical coding jobs in the coming years. And so for this medical coding, right, you need to right you can have this certification within a short duration. So unlike right professional other professional certifications where you have minimum 3 years or 4 years, right, to study that and obtain that credential. So here you can do this within a short span. So within even 3 months, our training program is more focused about like the 8 weeks training program. So it will be like 2 months, and after that you need some preparation and you can appear for the exam. Like within 3 months, you can get this like CPC credential and you become a certified coder. So that's a short duration, right? You can become a professional when it comes to medical coding certification. Okay, so you can launch your career within the short duration, which is just 3 months. And right, if you are clearing the examination, you will be having this credential called CPC, Certified Professional Coder. So after your right original credential, you can put this right as a second credential. Okay, and the job opportunities are there in the Australia, UAE, and US. because there is a lot of demand for medical coding professionals in all these countries. And as I've said multiple times, outsource medical coding jobs, right? India is the hub for all these outsourced medical coding jobs. So you have major, right, chunk of work, right, distributed to the Indian, right, MNCs, and right. So India has become the hub for medical coding, right, as an outsourced job. Okay, so next is a certification. So this certification provided by the American body called AAPC, right, and it opens the doors for, right, career advancement after, right, your graduation, and the training requires very short duration, and right, with immediate placements in the MNCs. So there is a high potential, right, and you have a, right, expertise in medical coding. You have the chances, right, of working in the US healthcare system also, right? And this certification is recognized worldwide by, right, different insurance companies, right, different doctors, and different government regulatory, right, authorities. As I've said, right, UAE and Australia has also adapted, and the CMS, right, mandates the usage of codes, right, for all healthcare services. So that is why US has, right, a lot of openings in medical code. Okay. And if you get this certification, CPC, right, you have I mean, your individual long-term career goals can be achieved quite easily. So you have a lot of different growth opportunities within the role of a medical coder. So you can become, within a short duration, like 1 year, 2 year, you can become a senior medical coder. Then after that, you can become an auditor, and you can also become a team manager and manager. So the scope, right, of career development is also high. Plus, right, you can also become a consultant in different medical offices in the US itself. So if you have that expertise, like 5 years of medical coding expertise, you can become, like, a consultant, so you can, right, work on different medical coding projects in the US itself. Yes, the market is, right, such that it is demanding, right, and the job opportunities are wide, right, and certification is valid, right, in many countries, including that of India, Philippines. So India and Philippines play a major role because their most of their outsourced jobs are, right, processed in India and Philippines and US. So there is a direct opportunity. UAE, they have adapted medical coding, and there is also a lot of, right, direct opportunity to be a medical coder within the healthcare offices, hospitals, right, in the US and UAE. Okay, so about Chash Academy. So we are based in Coimbatore, and we established in the year 2020. And so this was established by one of the, right, ex-AAPC boss, right? So he was the, head sales head, right, for India and, right, UAE and Philippines. So that is called the AAPC International. So he was heading that, right, unit of AAPC. Okay, and so this institute also provides career opportunities, right, and professional training and certification. And yes, our mission is to produce good quality coders, right, with the expertise in the medical coding, right, different scenarios, and who can excel in their career as a medical coder. Okay, so our training is more comprehensive, right, and we also offer comprehensive healthcare related training solutions to the corporates also in, like, India. Okay, Sash Academy. So Sash Academy is an AAPC approved education partner, right? And we provide a AAPC certification training, and also recruit the freshers all over India, right? And we have a AAPC approved 2022 curriculum, which we follow for our medical coding training. And so as myself, I'm a trainer here, right? I am a training manager also. So I also, right, train pupils, and right, I'm a approved and certified instructor. And we also offer AAPC's learning management solutions or learning management system access to students, which is called AAPC's Blackboard Access, right? So then we provide both classroom and virtual training options, and we have both blended, right? So at the same time, people can come to office and come online and attend the classes. Okay, and we also provide this post completion certificate. So the advantage of this course completion certificate is, so we have like once you become a certified professional coder, you have like 2 years, right, as a period, so in which you will be called as an apprentice, right? So you'll have this CPCA credential for the first 2 years. Okay, but if you have a certification of, right, course completion from a approved training partner like Shash Academy, you will have only 1 year of apprenticeship. So after 1 year of experience, you will become certified professional coder, right, who's a professional. Okay, so instead of 2 years of apprenticeship, you will have only 1 year of apprenticeship. So if you are right, undergoing training at an approved training center like Shash Academy. Okay, so that's it for the today's session about the medical coding and the process. So do anyone have any doubts regarding whatever we have seen today? Any doubts? Anything you need to be
Uh,
clarified?
Mr. Riaz, could you let us know the course fee for the CPC exam and the trainings that you do?
Okay. Course fee for the training, CPC exam training, you can reach out to Aika, right, or right, Wasima, who is the presenter, right? So you can reach out to Aika at this number, right? So they can explain you about the course fees and other thing. So regarding certification, there is a right exam fee that we have to pay to the AAPC. It will be like $720 or so, right? If you directly go to it. But if you do it with us, it will be a less cheap, I mean, cheaper, right, than $720. So that's additional advantage of doing the course in an approved training center like us. Okay, so course fees, you can reach out to AICA because they will be telling you what will be the cost for this, right, CPC exam training. Okay, any other
Thanks.
doubts regarding the process, regarding the training?
Yeah, I am from Sri Lanka. This is online only. It's online course. So
Yes, it is online. Okay,
otherwise, we have
completely
to
online, we
come
can train you.
to India by virtual, so by physically, online. So qualification for this process.
Okay, so qualification as far as right, AAPC is concerned, so AAPC does not have any such right minimum qualification for us to undergo this training. But certain
Okay.
companies have this general rule that you should be minimum a graduate, right? In any discipline, you can be a graduate, then you can have the CPC certification to work as a medical coder.
So once we finish these courses, we can earn from our home, or we have to go some abroad or something.
I think AICA will be clearly telling you, so whether you can have this at home, right, or right at their institute. So we have a blended opportunity. So you can either right come to right AICA, or you can have this online also.
So the online earning after the finishing the process, the earning process can we do at home, or we have to go physically some other abroad other than our country.
I'm not able to hear you clearly. Can you come up again?
So
No,
once
miss?
we finish this course, once we finish this course, for the
Yeah.
earning, we have to be at Sri Lanka, or we have to go some other abroad other than our country.
Okay, so as far as right, Sri Lanka is concerned, there is I mean very less right scope that you can work in Sri Lanka, but you can work in other different countries like UAE, right? You can go there, right? Have this with this certification, you can work in UAE. And I know, right?
From our country.
Why means there is right very few companies, right, so that do medical coding in Sri Lanka. As far as I know, right, in India it is different, and UAE and US you will have direct openings. Like it will be different from what outsourced jobs we call in India. So that there you have direct right openings where you can work in different hospitals and different physicians. That's the case in US, UAE, and Australia. Outsourced job, right? So they will pay very less, right? Compared to the direct jobs.
Okay. Thank you.
Okay, so one more thing, certification, right? There is no validity for the certification, but for membership, right? You have a validity. Membership is valid for 1 year, so we have to renew our membership with AAPC. So that will be at a cost that AAPC will determine, right? So it will like student membership, it is like $125. So which you can pay with the exam bookings, right? So that will be additionally like totally you have $720, which includes the student membership also, right? But after 1 year, you have to renew the membership based on right what the membership cost appears in the AAPC website. And for most of us, right, most of the medical coders who work in different MNCs, so the MNC will renew our membership. So every year they will take care of our membership. Online job opportunities, yes, there. So there are a lot of right different companies that provide online opportunities, right? But so that's a scenario, right? So based on the different companies. Okay, so you can take this opportunity to work from home, or if they require. So some companies require you to work from their right premises, so you have to go there and work. So there are both opportunities, like work from home is also there, and right, you have to work from office also. Okay, so SASH Academy certification is for CPC exam training, right? And if you complete this certification, you will be eligible to appear for this right CPC exam. And once you clear this examination, so you have the right opportunities worldwide, UAE, right, US, and Australia also. Any other questions, guys? So I think there is no other questions, right? So I can wind up right now, right? So I would like to thank Eka for organizing this, right? Dr. Wasima, especially for the introduction, right? And thank you all of you. I think I have to appreciate your efforts because, right? So this weekend at your right own family time, like you are showing this interest to have this, right? A new right career opportunity, a new study, right? Which right you are willing to do, and you have spared your right, valuable time to right have this seminar right with us today. So thank you so much, every one of you, and have a great evening, and have a great week ahead.
Thank you so much, Mr. Rice. It's
Yes.
it was a great and wonderful presentation about medical coding. For so many people, it is completely new profession or new course. It is completely new to Sri Lankan also. So ICA was the first institute that have this kind of introducing this kind of course to Sri Lanka. So thanks again for your brief explanation about medical coding. And for the participants, so please stay tuned with us for more useful webinars like this. And you have asked so many doubts about the course fee and examinations like that. So we didn't decide the course fee yet because it depends on the participants for the course. So if we have 20 or more than 20 students, we can have the exams in Sri Lanka also. So if not, we have to travel to India and have to sit for the exams. So ICA is trying to do more work in this field. So in future, we will be definitely have the exams in Sri Lanka. So for more details about the course fees and all, please contact admin number to get more details. And thank you so much. And thanks once again to Mr. Riaz. Thanks, sir.
Thank you, Eka, and thank you, Dr. Wasima, and thank you all of you.
Okay.